Dear colleagues, esteemed speakers and guests, it's a pleasure and honor to be with you today for the second day of our Mental Health Summit. And sorry, we have some... Oh, now it's fine. So it's a pleasure to be with you here, our Mental Health Summit, hosted the very first time in the European Parliament. As many of you may know, I'm a surgeon by training, but what you might not know, that I began my medical journey specializing in psychiatry. And when I switched to surgery, I was shocked by how little attention mental health gets in other specialties, how little information people get about their medical conditions, and how big was the need for this information. And it was a motivation for me to start my health educational platforms to explain what's happening to my patients and also support them. Because I think sometimes only a kind word can change the world for patients in very serious illnesses. But maybe I will talk a bit more about this at our evening reception, because we are running out of the time. But what I would like to mention that I am here not only as a doctor, but also father and a husband and representative of EU citizens, each of whom has a stake in mental health, whether directly or indirectly. Mental health requires a truly multidisciplinary approach, something we are highlighting through our summit. Our 84 million people across the EU are affected by poor mental health. Even before the COVID-19 pandemic, people across EU suffered. And as we just discussed yesterday, since then, during the COVID, these numbers quadrupled. And we need a comprehensive horizontal strategy that cuts across all areas of life. Reflecting on yesterday's panel discussion, it is clear mental health cannot remain confined to clinics, treatment facilities or crisis hotlines. It must be embedded in our housing strategies, or urban planning, our educational systems, and how we support our frontline workers and marginalized communities. In short, mental health must be recognized as a fundamental pillar in how we build and sustain our societies. In this context, I want to draw your attention to two crucial and often underexplored dimensions: culture and women's health, that we will dive into in our discussion today. Culture is not a luxury, it is a necessity. It shapes how we connect, how we express our emotions, how we find meaning, and how we heal. Participation in cultural activities, from music to literature to theater, dance, visual arts, has been shown to improve mental well-being, reduce anxiety, and foster a sense of belonging. For many, especially those living in isolation or dealing with trauma, cultural engagement can be a lifeline. This is why integrating culture in our mental health strategies is not simply desirable, it is essential. We must also talk about women's mental health, which has its own unique challenges. From hormonal changes and caregiving roles, women often face a mental health burden that is overlooked or underdiagnosed. Issues such as postpartum depression, anxiety related to fertility, or psychological toll of balancing work and motherhood must be brought in the spotlight. Women's mental health is public health, and recognizing this in our policy responses is long overdue. I'm particularly grateful that today's session will give a space to these intersections, and I look forward to the insight that will be shared. Finally, I would like to warmly thank Commissioner Mikalev, Commissioner for Intergenerational Fairness, Youth, Culture and Sports, for joining us today, for sharing his vision and the Commission's plans in these vital areas. Now, I have a pleasure to giving the floor to my co-host and their colleague Zoltán Tarr to deliver his opening speech. Thank you.
Thank you very much. Thank you very much, András. It's a warm welcome to all of you. And before you think this is a Hungarian mafia or something who is organizing this and behind this whole mental illness and mental health issue, that is not true. Unfortunately, this is a European-wide phenomenon. It happens to be that András and myself, we both belong to a Hungarian delegation. I'm working in CULT and working closely with Commissioner Mikalev, and this is really a pleasure for me to be here with you and open this second day of the Mental Health Summit, even though we are a bit late because today is a special day in Brussels with the strike, but we hope that it doesn't affect our will of discussion and our enthusiasm to find solutions for these very crucial problems. This summit was born out of urgency, and this is not something just what we see and what I see personally, but this is something, an urgency which we all see in Europe. One of the issues which is widely discussed in the European Parliament, in the European Union now, is mental health. We all see, and countries are seeing, that this is a crucial issue, not just a personal issue of some, but this is an issue for the whole society. András already mentioned some statistics, but let me tell you some more very saddening statistics. 1 out of 3 young people in Europe struggles with mental health issues. And what is even more worrying, suicide is now the second leading cause of deaths among young Europeans. And this is not only a health crisis, as we can see that. It has a very deep social and political and economical background. It is also an issue for all of these aspects. Even before the pandemic, the COVID pandemic, the cost of mental health related costs in the EU exceeded 600 billion euros per year. That is over 4% of the GDP. That's a huge amount. And I think that is exactly why this summit matters. And this summit matters exactly because I also have some teenagers in my family. I have 3 teenage children. One of them is struggling with mental health issues. And we are trying to provide her as much as we can, but we also see how difficult it is. Because there are not enough doctors, not enough psychologists, not enough institutions to deal with the issue. And this clearly exceeds the possibilities of our loving family. We need professional help. People need professional help. People need structures which can help them to support those of their loved ones who are struggling with mental health issues. There is a growing consensus among many of us that there is a need for prevention, inclusion, and cross-sectoral cooperation. This is not just a simple mental health issue. We need to collaborate with many sectors, and we need to find solutions together. We cannot think in silos, saying that, okay, those professionals who deal with solely mental health issues, they will solve the problem. This is much more complicated and complex than that. We need joined up policies that link health, education, digital governance, and crucially, culture. And that is what is the focus in today's discussion, how culture can be part of the solution. And one last comment which I would like to make, and that is very important for us, and I believe it is very important for Commissioner Mikalev, is the inclusion of young people into this whole issue. We don't want to talk about them, we want to talk about this issue with them. We want them to be part of finding the solution. They are not the problem whom we have to deal with, they are also part of the solution. So today we do hope that we will not just see that this is important, but we will experience that this is important. I see only young faces among us, and I hope that they will share their stories and their experience of how they can deal with and what kind of suggestions they have in dealing with this very serious issue. Having said that, this is my pleasure now to introduce to you Commissioner Glenn Micallef, who is, as it was already said, Commissioner for Intergenerational Fairness, Youth, Culture and Sport. And just one word, intergenerational fairness. We don't have time to discuss that, but that is something very exciting. I think everyone asked Commissioner what we mean by that. So please keep your interest on that for later. And let's listen to Commissioner Micallef now. Thank you very much.
Thank you, Zoltán, first of all, and thank you, András. András, when you were speaking, you mentioned something that really caught my attention. When you said that mental health is a crucial part of public health. And I think I would go a little bit of a step further than that. I think mental health is a fundamental right for many of our citizens. So that's why we gather to have discussions like this one that we are having this morning, which brings us policymakers with stakeholders, with youth, and with advocates and with professionals to reflect on the situation that we face in this respect in relation to mental health across Europe. First of all, to take stock of the situation, to take stock of the progress, but also of the challenges that continue to emerge, of how we can support our populations, how we can support our citizens when it comes to mental health, and how we can find inclusive solutions together to improve the well-being of our citizens. When I say well-being, it's physical well-being, but it's also mental well-being, because the two are crucially and intrinsically linked. And Zoltán has already made reference to the very worrying situation that we face here in Europe in this respect, where we have what I call a silent pandemic in relation to the mental health of our citizens, where approximately half of our youth in Europe are facing some kind of challenges, be it loneliness, be it anxiety, being stress-related depression or feelings of depression more generally. A situation that has been made much and much worse by COVID. So when COVID first struck, we had roughly 84 million citizens who had some kind of or reported some kind of issue related to their mental well-being. And after COVID, the number grew exponentially, and this challenge grew with it. Of course, the causes of challenges related to our mental well-being are very diverse. There's not one cause, but there are a wide range of topics and causes that I know have been addressed at the summit, such as the impact of instability and war and conflict on our mental well-being. But then there are also other issues, from the endless online scrolling for youth to the stream of information that we have, social comparisons, exposure to unrealistic standards. These can all lead to a feeling of anxiety, loneliness, low self-esteem that can have huge negative effects. And this is impacting the emotional well-being of our youth especially, but also of our citizens in Europe more broadly. And the challenges are not few. Especially, and this is also a point that is quite worrying, data is suggesting that the problem amongst women is exponentially higher. They report that they experience challenges related to mental health like depression and anxiety much more than men. But then the other side of the coin is that men are the ones who are more likely to die by suicide. So the situation is nothing short of shocking. And here I want to also make a specific reference to vulnerable groups in our society. Vulnerable groups are far more exposed to the threats of psychological impacts than other groups. And here the challenge is much larger, because they are the challenges related to their vulnerability, linked to limited access to mental health. They are linked to financial insecurity, to social exclusion, to lack of decent work, to lack of proper working conditions, poor quality of life, and challenges in relation to housing that deepen this inequality that we face, that prevent many from receiving adequate care. And this brings me to my next point, which is our response to these challenges. And here, again, Zoltán, you hit the nail on the head when you mentioned the word prevention. Prevention is key, and having healthy minds is as important as having healthy bodies. We promote physical activity because that's important for our physical health, but it's equally important for our mental health. And in this respect, I am very pleased to see that to tackle this rise in the number of Europeans that are suffering from poor mental health, the President made it a point in our political guidelines, which we had so many discussions on in the summer of 2024, to step up our work on preventive health, with a specific reference in particular to mental health. So this is something that we recognize as a political priority in this Commission. Indeed, there is an increasing body of research that shows the importance of this preventive approach. And already in the Commission, the comprehensive approach to mental health with adequate and effective prevention is one of the 3 guiding principles in the way we deal with this issue. So this brings me to a point I want to highlight today, which is the role of culture in promoting mental health and well-being. And when we speak about culture, culture is part and parcel and deeply linked to our quality of life, to our well-being. The positive effect of culture on well-being is supported by a wide body of research going back a number of years, but also it's something that is recognized by our citizens. The last Eurobarometer on culture, published 2 weeks ago, shows that for a huge number of Europeans, we're speaking of around 90% of Europeans, that believe that culture has a positive effect to their physical and emotional well-being. So the potential for the cultural sectors to boost our mental health is something that we recognize, our citizens recognize, and it's recognized in our work plan for culture, which continues to guide our work in this respect. And in fact, this has established, through this work plan, we have established the creation of a dedicated expert group which brings together cultural professionals and health professionals to find common solutions and explore synergies between the 2 sectors. The report from this group will be published this autumn, and it will include a showcase of best practices that have been adopted already in the European Union, and provide policy recommendations for us to consider and discuss with the member states. And then this will also build on the progresses and the achievements of our actions under the Creative Europe program, such as the preparatory action Culture for Health, that was proposed by the European Parliament, by the way, and rolled out by the Commission with a consortium led including with Culture Action Europe, which I see here in this room, and I'm sure that you will delve much more into detail about this into this discussion. So I'll leave you to tell a little bit more about this. And of course, these are just 2 examples that I've mentioned. There are many more projects that have been deployed by Europe's cultural and creative sectors in this respect. Also initiatives that we proudly support through our programs like Erasmus+, Horizon Europe, Next Generation EU, and Creative Europe. And I want to here mention just one example. The program Culture on Prescription as a Prescription in Europe. which is a program that is supported by EU funding, which explored the potential of what is called cultural prescriptions to address issues such as loneliness, social inclusion, and mental health, and that help patients to improve their health by taking part in cultural activities. This is just another example of how across Europe there is a growing appetite to roll out innovative approaches to enhancing people's mental health. These practices will and can offer inspiration for our broader work to seize the power of culture as an important driver of social change. And then I have an appeal at the end of my intervention today. Currently, we're having a consultation on the design of a culture compass, which will be our vision to seize the potential of culture in many areas, to have an overarching framework that will help connect culture to our political priorities, including the promotion of health and well-being. The discussions with the cultural sectors have shown that there is a growing traction for the role of culture in these efforts too, in efforts related to well-being. So I encourage you all to take part in these consultations to bring this issue more to the front. And I expect this to be an important part of our political vision in the years to come. To conclude, I think it's important that we continue our work together, that we continue to have these discussions, because only through our collective efforts can we break down stigmas in relation to issues related to mental health that can or should allow people to seek support when they face issues, to seek assistance before it becomes too late. So in this, I count on your support. I count on your voices to be heard, to support our community, to support the cultural community, to harness the power of these sectors to help turn the tide in the struggle that we face to address mental health issues in Europe. With this, I would like to thank you all for your commitment to this cause and for these discussions that we are about to have. Thank you.
Thank you very much, Commissioner. And now I would like to give the floor to our first panel discussion, prevention and early action in mental health.
Yes, and we welcome Cornelia Kish, our panel moderator, and we hand over the mic to her. And looking forward to your speech and the program.
Hello, good morning, everyone. While my fellow panelists come to the floor, I just first want to thank very much to András, Kulja, and Zoltán, Tarr, as well as Commissioner Glenn Michele for being with us and also for hosting this very important event and including culture in the discussion on mental health. It seems I will have to move, yeah? So, now from a new space. I think I will not be very long in my introduction. I just want to let everyone know that Culture Action Europe is a European cross-cultural network of cultural networks, organizations, artists, activists, and academics and policymakers with over 250 members across Europe. many of them are culture networks themselves, so therefore we are often referred to as the umbrella organization that represents the cultural sector towards the European institutions and also the UN institutions as well. I think the best way to start now is with a video from Dr. Daisy Fancourt, who will let us know a little bit of the evidence specifically dealing with mental health. Dr. Daisy Fancourt has been the co-author of a very important 2019 WHO report titled, "What is the evidence on the role of arts in improving health and well-being?" Actually, the cultural sector has been very vocal about the fact that culture contributes to health and well-being for a long, long time. But the fact that the World Health Organization is talking about it, that means that the evidence about this has been grown to a level where we shouldn't just do project by project implementations, but we should move to a strategic approach, including the cultural sector in the discussion on health and mental health. So I'd like to ask to play the video of Dr. Daisy Fancourt. Thank you.
Hello, I'm Daisy Fancourt, a professor at University College London and director of the WHO's Collaborating Centre on Arts and Health, and it is a pleasure to be giving you a whistle-stop tour of how the arts can affect our mental health. Back in 2019, we published a report with the World Health Organization on the evidence base on arts and health. This report summarised the findings from 3,500 studies showing that the arts play an important role both in the management and treatment of mental as well as physical illness, as well as in helping to prevent the development of mental health problems in the first place. As an example of this, there have now been thousands of studies published that have shown the value that the arts have in supporting symptoms like anxiety and depression. If people already have diagnosed anxiety and depression, engaging in arts activities like music groups, dance, crafts, visual arts, helps to reduce these symptoms. Meta-analyses of trials that have pooled the results from lots of different studies show that people who engage in the arts experience reductions in their symptoms of anxiety. And these results get stronger the more sessions that people attend, with people who attend 12 or more sessions having even greater decreases in their symptoms compared to people who only attend 6 or so sessions. We see similar results for depression as well. People who engage in arts activities, including art therapies like music therapy, as well as listening to recorded music, experience reductions in symptoms of depression. And again, these results get stronger the more sessions that people do, increasing from just little results within 1 to 4 sessions to clear results within 5 to 8 sessions and more marked improvements within 9 to 12 sessions. Lots of trials that we've conducted can show these results more clearly. For example, we've conducted trials at University College London with partners looking at how group drumming could help people who already have mild to moderate mental illness. We've found that within 10 weeks of drumming, people experience reductions of 23% in anxiety and 38% in depressive symptoms relative to control groups, and these results are maintained 3 months after they finish drumming. We've found that for mothers with postnatal depression, going to singing groups leads to reductions in their symptoms and recovery a month earlier than people who either go to play groups but non-artistic play groups, or people who don't have any kind of additional intervention. And we've shown that these benefits exist as well for people with physical illness. For people affected by cancer, singing in choirs helps to improve levels of well-being and reduce levels of anxiety amongst those who take part compared to control groups. We see similar results for specific arts therapies, arts activities that are developed and led by trained therapists. In fact, people who have arts and music therapy alongside standard care for their mental illness, like medication or other psychological therapies, experience greater decreases in anxiety and depression and more improvements in their well-being and quality of life, highlighting the role that the arts can play augmenting the effects of traditional mental health treatments. And we also see these effects occurring even in severe mental illness. In a large-scale trial of arts on prescribing that we've just concluded with colleagues in Greece, we've shown that people with severe mental illness experience marked improvements in anxiety and depression if they are referred to taking part in arts activities like going to museums, galleries and concerts. And in schizophrenia care, music therapy can be an effective tool for helping to reduce some of the symptoms of schizophrenia, both in the short term and in the medium term. These results are also importantly seen in people who don't actually have diagnoses of mental illness. Everybody can experience feelings of anxiety or low mood, and meta-analyses consistently show that engaging in arts activities helps to reduce these symptoms. Importantly, engaging in the arts can also help to reduce symptoms developing in the first place. We've used epidemiological approaches to test whether arts engagement is related to subsequent mental health diagnoses. Looking at 25,000 people living in the UK, we found that people who participate in the arts or go to cultural events over time experience lower levels of mental distress, higher mental functioning and higher life satisfaction. These results are found over time, so arts engagement predicting future better mental health. And critically, in these analyses, we have to consider lots of confounding factors. These are factors that could explain a relationship between arts and mental health. Things like demographics, wealth, existing health, other behaviours. And we consistently show that these associations between arts and subsequent better mental health are found independent of all of these so-called confounding factors. In fact, when we've looked at samples of people with no history of depression, we found that the more culturally engaged people are, the lower the risk of them developing depression at any point over the next 10 years. Once we've taken account of other explanations, people who engage in cultural activities at least once a month have half the odds of developing depression over the next decade compared to people who never engage. And we don't just see these results in the UK. We've undertaken analyses in countries all over the world showing that people who engage more in arts and creative hobbies have lower rates of depressive symptoms over time, higher rates of life satisfaction, higher rates of self-reported health as well. But we have a challenge. If you ask the average person in a European country or in the US, did you engage in the arts yesterday? Only 1 in 20 adults would say that they did. And if we look at adolescents, we find that access to the arts and education varies wildly. In Italy, only 1 in 3 15-year-olds say they have any access to the arts in school, whereas in Korea that number is 92%. So this shows that we are not currently engaging in the arts as much as we probably should if we want to experience the mental health benefits. There are lots of solutions to this. One promising intervention is social prescribing. Social prescribing helps to connect people to activities like the arts in their local community. In the UK, it is now a national programme, and we've demonstrated that people who engage in arts and other activities through social prescribing are often those who need it the most. They're people with more long-term conditions, living in more deprived areas, making more use of health services. We've developed new guidelines and practice for how social prescribing for things like the arts can be delivered within child and adolescent mental health services. And we also run an international social prescribing youth network for other countries who want to engage in similar work. In fact, social prescribing is now happening in over 40 countries around the world. And our evidence suggests that it is worth us engaging with programmes like social prescribing and encouraging people to engage in the arts. We've undertaken health economic assessments of what is the health economic value of the health benefits people experience from engaging in the arts. If we look at mental health, for example, in the UK, we've found that attending and participating in the arts has diverse mental health benefits that are worth over £15 billion to society every single year. And this is through combining looking at the effects on individuals, like quality adjusted life years, as well as looking at the health and social care costs avoided and benefits for productivity. In fact, when we look at arts interventions, they're often more cost effective than other kinds of interventions that are commonly used in mental health. And schemes like social prescribing are starting to demonstrate returns on investment of between £2 and £8 for every pound that is invested. If you're interested in seeing more of our results from the slides I've shown today, you can look at our Arts and Cultural Engagement for Population Health report on our website, and also a new book which is coming out on this evidence base at the start of 2026. All of these resources, including the original World Health Organization review that I mentioned, and all of our research papers, are available on our website. I hope you'll agree that arts have an important role to play in supporting mental health, both in prevention and management, and it's a resource we're currently underutilising, and I hope that we can use much more in the future.
Well, we thanks very much Dr. Daisy Fancourt for sending us this video. She would have liked to be with us, but she's in a very remote area. Therefore, she was not sure that her internet would be actually working for delivering properly this message. Next, I'd like to turn to Member of European Parliament, Vytenis Andriukaitis. Did I go well? Who was very kindly accepting our invitation. And he is from the social group of Progressive Alliance and Socialists and Democrats. And he is special because he's a former European Commission for Health. Your floor is yours. Thank you so much.
Thank you so much. Thank you for your kind words. Of course, thank you for the invitation, and I congratulate my friend András. You are very active. It is very important. You can raise our activities to keep public health issues high on the political agenda. It's really nice, and of course, congratulations to my colleague, you just rightly mentioned about all activities. Colleagues, I couldn't agree more with first presentation, because when we're speaking about art, when we speak of music, about sports, all those instruments should be used addressing mental health problems, no doubt. No doubt. My statement is a little bit more general because I am not concretely involved into concrete topics, into concrete assessment of how culture can help us solve mental health problems. And of course, just you rightly mentioned about Hungarian issues, not about mafia. It's about Hungarian, common urbanization. It also creates mental health problems. Sorry to say. But of course, I am very happy that you are just so active in this field. Of course, among people of working age, half of all illnesses and mental health disorders, half of all illnesses. Can you imagine statistics? Research shows that mental and behavioral disorders account for half of all disability benefits and absenteeism. Once again, I can try now just to show a little bit economic, component. Mental health promotion and prevention interventions not only improve societal well-being, but are also economically beneficial, as they help reduce long-term healthcare costs. You know that in mental health, long-term care is a very big problem. Increase of work productivity and alleviates social problems. According to a systematic review covering 65 economic evaluations, most mental health prevention and promotion interventions were found to be cost-effective or even cost-savings. Particularly effective were interventions aimed at children and adolescents level, such as cognitive behavioral therapy programs, which not only reduce the risk of mental disorders, but also provide a positive return on investment. Programs focused on strengthening the mental health competencies of school staff working with children have also proven effective. The economic benefits have been confirmed on a broader scale as well. For example, a study by the London School of Economics in the United Kingdom shows that investment in mental health services can yield greater economic growth and national well-being than investment in the new road infrastructure. Can you imagine about what we are speaking? I always trying to raise awareness and to raise, when you are speaking of competitiveness, about industry, please keep in mind that investment in human capital is the best asset in the EU and can yield much more than investment in steel and coal industries. But now narrative is always talking about, oh, industries, or where people are. And can show very, in reality that it is investment very big asset. The report emphasizes that spending on mental health and addiction treatment services offer a strong economic return by reducing health and social costs while increasing labor force participation and productivity. Enhancing public psychological resilience is especially important in the face of emergencies. And we know that we are facing a lot of emergencies, war, pandemic, and so on. All emergencies provokes a lot of problems with our, mental situation. Individuals who already exhibit low psychological resilience or face psychological difficulties before a crisis are more likely to experience worsened conditions during such events. Mental health disorders and low psychological resilience reduce the ability of individuals and society to respond optimally in crisis situations, to plan, solve problems, and care for themselves and others. Therefore, one of the most important protective factors in the face of emergencies is individual psychological resilience, which can be strengthened through mental health promotion and prevention measures. And art, as one of the excellent examples, how raise individual resilience. That is a problem. Investing in mental health prevention and promotion is not only a socially responsible decision, but also financially sound one. A strategic approach to public mental health policy at the EU level should begin with a unified framework that emphasizes prevention, early intervention, and mental health promotion across all member states. And here it's up to us. We know that we have a comprehensive approach on mental health. Now we need strategy, umbrella strategy, which allow us to ask member states to harmonize their national plans and activities. Only one way. Otherwise, it would be very difficult. This framework must align with broader public health goals and recognize mental health as a cross-sectorial issue affecting education, employment, social inclusion, and human rights. The EU should encourage member states to integrate mental health into all policies, much like the health in all policies approach, while offering guidelines and funding mechanisms to support national strategies that reflect local context but align with shared European objectives. We need to have shared European, and we need to align those at local levels also. Mental health largely depends on socio-economical competence. That art shows is exactly. The emotional component is very high, such as emotional regulation, and these are competences that can be acquired. Therefore, a particular emphasis should be placed on investing in the development of socio-economic emotional competences, especially in children. At the same time, investment in digital mental health solutions and community-based care should also be prioritized. On the other hand, for example, in suicide prevention, it is very important to highlight measures specifically focused on suicide, self-harm, suicidal behavior, and ideation. The development of national suicide prevention strategies has been identified as a proven systematic, evidence-based response to preventing suicide that combines both community-based approaches and government policies. They can include 5 directions. First, early suicide prevention and media monitoring. Second, recognition and referral, support and service system for people in suicide risk or crisis. Then, help system for relatives who lost loved ones because of suicide, and monitoring and evaluation of tendencies, of common tendencies related to such a difficult problem as suicide. These efforts should be accompanied by evaluations to ensure that policies are addressing disparities and supporting vulnerable populations effectively. Finally, addressing mental health stigma and promoting mental health literacy across EU must be core components of the strategy. EU-wide campaigns and education programs can foster understanding and reduce discrimination in workplaces, schools, public entities, and healthcare systems. In addition, the EU should facilitate cooperation and knowledge sharing among member states through dedicated forums like this one, training networks, once again we just mentioned networks, and strategic partnerships with civil society organizations. Such collaboration can strengthen resilience at both at the systemic and community level, ensuring that mental health becomes a sustained priority across the EU. I remember our action in the Commission Night Through the Light. It was created by Phil Hogan. I support it very much. It's an excellent idea. Let's do our best and let's see how art can help us solve the problem. Thank you.
Thank you very much, Member of European Parliament, Vaitenis Andriukaitis. Actually, what I really found important, and it is also part of the Culture for Health report, is this investment in prevention. Everybody talks about it in the health sector. There are trials, of course, to make it happen. But of course, there is this wrong pocket problem that often people say is actually preventing systems to change, because the saving on the prevention side is often in a different pocket than on the management and treatment side. And I wonder if steps towards that problem could be made also on EU level or through propositions. You want to answer?
If I may, I can react immediately. Prevention requires long-term strategies. Prevention measures should be implemented 10 years, 20 years, 30 years. And of course, all politicians do not like prevention. Why? Because they have only 5 years period. They acting on, AI, hospital, and so on. But prevention is better than cure. Okay. And how can we invest into prevention? We need to sustainable investment capacities, because prevention should, be in continuity. And we need to have common prevention strategy at EU level, including all issues. Otherwise, prevention is better than cure. It will be empty slogan. And we need to change situation. We need to change paradigm once again. I always try to convince people. And when I was commissioner, I told, I am commissioner for prevention, for health, but not for diseases. For health, because health is social, mental, and physical well-being, not merely absence of disease and infirmities. I also try to convince people. I am commissioner responsible for health. It means social, mental, and physical, and mental is one of the biggest problems. What we need long-term investment strategies. Please change behavior of our ministers of finance. Please change behavior of our heads of states and governments. Can I tell you, when in previous time, Commission proposed 9.3 billion euros addressing EU for health program, heads of states and governments decided to cut till 1.3. And only after European Parliament started to fight, then you see 5.3 billion. It means mentality of heads of states and governments is very low one. We need to help them because it's really a mental problem.
Thank you for that.
Yes.
Thank you very much. This would maybe lead to my presentation, which I will seriously cut because of all the... Thank you very much for your intervention. Because of the slight delays that we already have. I just very quickly will go through what has happened in the area since 2019. One crucial step was the Culture for Health project and the Culture for Health report, which you see here, which has actually 3 parts. We have looked at also how culture contributes to health, but we also looked at how culture contributes to subjective well-being and community well-being, so really bringing these community aspects in it, and have put together a set of recommendations which are there to use. And we really hope that through the intergroup on mental health that has been just formed now in the European Parliament, you can push this mental health strategy that you are calling for, so that there is a follow-up on the comprehensive approach to mental health, and culture has a role to play in that. So basically, the Culture for Health report evidence kind of was showing how, for example, culture contributes to self-expression, empowerment, increased social engagement and bonding and inclusion. Artists are very good at actually breaking stigma around mental health conditions and also help to increase social engagement and reducing isolation through artistic activities. Because it's one thing if you tell also for health communication that, let's say, you should be less on your phone. If you do this in an improvisative theater group where one of them is just being constantly on their phone and there's no possible to talk to him, then people actually feel it. And this is how actually arts can bring better understanding of the problem. So another thing that after the Culture for Health project, we've been trying to continue, and we are very grateful that we could launch the Culture and Health platform, which is across 12 countries, done by 15 organizations. And the aim of that is actually supporting the artist side in this field. It supports emerging artists in the field of culture, health and well-being, and it will run for 4 years, which is actually a little bit better than usually this 1 and 2 year projects that are happening. We have lots of course, we are giving financial support to artists to implement projects across the EU, but we also have a lot of capacity building programs. We have a very successful artist roundtable where actually artists are sharing how to work in these environments and what their challenges are, but also what actually works. And we learn a lot from these artist roundtables. And of course, there are networking activities and awareness-raising webinars towards the health sector as well. I was thinking to show a little bit in my original presentation of this political landscape that actually already Commissioner Glenn Mikalev already talked about, mentioning also the open method of coordination group of the EU member states on culture and health, and also the comprehensive approach to mental health. But I'd like to talk about also the Council conclusion on access to culture, which for the first time was mentioning that social prescribing could be an example of getting access to culture to people who generally would not engage in culture. Actually, there is a new Council conclusion coming out from the Polish presidency, which is about promoting and protecting mental health of children and adolescents in the digital era. Actually, that communication seems to be quite bold. Of course, we don't know what exactly will be coming out of it, but what is important to know that in the conference of the Polish presidency, I was lucky enough to be present, and people were calling for regulation of the big tech companies, and also they were talking about promoting impersonal connections and positive face-to-face interactions among children. And they actually were talking about alternatives to screen time. We tell our youth not to be on their phones, but we don't tell them what to do instead. And actually cultural and physical activities and being out in the green space, we all know are actually very beneficial for our health and well-being. And why don't we then implement that? And last but not least, I wanted to bring the discussions to the current, let's say, realities of the European Commission priorities, which are competitiveness, democracy, and security. And how does culture actually relate to all that? Well, if there is a mental health crisis at cost of 4% of the EU's GDP, and it was also earlier mentioned, 60 billion annually is the cost. People with mental health conditions are, let's say, not that productive if we are looking only on economic terms. Therefore, if we don't tackle this issue now, we are not going to be competitive. Yeah? Another thing that is absolutely important is we talk about innovation in competitiveness. Yeah, we have to innovate. But innovation needs creativity and space for creativity. Now, we also have research saying that creative people are actually thriving in culturally rich environments. There is a strong correlation there as well. So if we don't fund culture, then we will not be competitive and innovative because people will go elsewhere. Also, regarding democracy, cultural participation enhances civic engagement, social cohesion, and collective well-being. So therefore, again, this is all evidence-based again, that we should talk about the cultural sector and be involved in this strategy. And last but not least, security and preparedness as the European Commission priorities. Investing in culture is a strategic defense against disinformation and hybrid threats are again important. This is again linked to the mental health state of the European citizens. We need to embed culture into the EU Preparedness Union strategy and the EU mental health policies as well. So there are lots of angles to actually lobby this current European Commission priorities because, as you also earlier mentioned, and you as well, where is the human element? We are competitive, democratic, and secure, and we think about preparedness is not possible without mentally healthy European people. So we are actually calling to bring the threads together. There is, of course, the culture and health portfolio. In DG Sante, we know that there should be a mental health support, that mental health support needs transformation towards the psychosocial model. We also know that there is a mental health crisis. There is a loneliness agenda in DG Employment and Joint Research Center. We have the care strategy, and you also mentioned with the growing of people needing long-term care, people taking care of them, what about their mental health? And we also have the educational well-being agenda in DG EAC, where when we talk about youth, of course, again, mentally not that healthy youngsters have usually worse grades. So bringing all these threads together, we really call to allocate more resources and build the capacity within the European Commission on mental health and establish a task force on mental health across the Directorate Generals. We could make sure that culture is at the table and bring these DGs together. It actually happened already because the comprehensive approach to mental health brought all these DGs together. We just should continue this. So, as stated earlier, we should have an EU mental health strategy, and also this mental health summit is calling for an EU youth mental health action plan. Tonight there will be a reception on this one. And of course, please follow up on the culture for health recommendations. Thank you so much. And now I'd like to give the word, and other things, because it's a surprise, to Katie Hersten from Arts for Health Austria, who actually is a dance artist and has been implementing, and they are part of the Culture and Health platform as well, and they are implementing very interesting projects in this area. To give you an example.
Yes, so as a dance artist and teacher, I get to share with you a practical way the arts, in this case dance, can support communities, their mental health and well-being, also in a preventative way. Magic happens in the studio. When an elderly gentleman with Parkinson's shuffles into the room and gets to forget his disease after half an hour of dancing the waltz, then that's magic. It happens when a young lady who's experiencing cancer, indirectly or directly, gets to feel something other than worry by moving her body. And it happens when a migrant teenager can be a part of a community, feel a sense of pride working with others who may not even speak their language. Move It is one of the projects that I'm presenting here today. And this was with a group of the latter category. It was a group of 25 migrant teenagers who are a part of the German support class because they recently arrived in Austria and do not yet speak the language. At the heart of the project is the creative process that leads to the planning and presentation of a dance performance. The group of young people explored themes relating to belonging, accessibility, visible and invisible barriers, and closeness. In a world where young people are constantly confronted with various forms of boundaries, we wanted to offer them the opportunity to discover their own voice through the medium of movement. We used an improvisational approach to encourage the young people to express themselves and find a voice with movement, and collaboratively develop a shared choreography. Through playful contemporary dance exercises, new perspectives on collaboration, integration, and performative art were shared with the dancers. And especially when language is a barrier, finding a body language can be liberating. Yes, please, Marie. German class pupils, children and young people who have only recently arrived in Austria and have little to no knowledge of German are certainly among the most challenged, as mentioned before, within the school system. Not only do they arrive in Austria without parents, but they also frequently struggle with trauma, exclusion, lack of basic education and social problems. The school should, in any case, be a safe place for them where, with all the possible support, they can quickly get to know the culture, the language, and the social norms around them. However, we noticed that the school alone cannot do this, or doesn't cannot meet the challenges that lay ahead. So this is where the arts come in, the arts and culture. And we decided on a dance and film project because dance as a non-verbal, whole-body communication can have a positive impact on social cohesion among the young people and can strengthen, as we mentioned before, resilience of each student to find creative approaches to dealing with difficult situations. But the best way to promote the arts and culture for mental health is to experience it. So, now I ask you to put your phones down, to close your laptops, to stand up, move away from your desk, and we are going to move together. So up you get.
It's all about yawning and stretching. Last time to twist it all out. No shoulders moving. Hips, knees, feet. Good. Thank you very much for joining me.
Well, you don't need to say anything else.
Twist again. Oh, in my young days, twist again.
This is also what people who have dementia say when they hear a song they remember. Twist again, que sera, sera. These songs are songs from their childhood that come back and magic moments happen.
Wow, I think we are all lighten up. So I'm asking the second panel to run to the stage now, or twist to the stage, I would say. Thank you very much. Really appreciate it. So we tried to structure the panels according to prevention and early action in mental health and how culture can contribute. And the second panel is about culture in management and treatment of illnesses. But of course, they are all interlinked. So I'm calling here my fellow panelist, Nils. And Nils Fiete will be our first presenter. Feel free to sit, and I'll speak longer so that you can get comfortable as well. Who is here with us from the World Health Organization Europe, from the Behavioral and Cultural Insights Unit. He will talk about cultural activities as a health behavior and also insights for mental health. He is also the one who has actually commissioned the World Health Organization 2019 report from the WHO side as well. So what arts can contribute to health and well-being. Nils, if you're ready, the floor is yours.
I am ready, perfectly timed. I do feel a little bit like I'm going to have to up my game a little bit after that intervention, so I'll try to keep you on your toes. Thank you so much for the invitation to be here. It's the second time, in fact, that I'm in this room having the pleasure to address an audience as well as members of the European Parliament on this topic. And I think a lot has happened in those 2 years, and I'm very pleased that it has. I'll come back to that in a moment. But since I don't know whether everybody knows me, knows arts and health, knows the field, I thought I'd take a couple of minutes just to provide a little bit of an overview of what we've been doing at WHO, and then speak a little bit more specifically about arts and health, and particularly the treatment and management of mental health. So, and also, given that we are a little bit pressed for time, I'm probably also going to contract my intervention a little bit. So at WHO, we've been on this journey for about 6 years now. Cornelia mentioned the publication of the 2019 scoping review on arts and health. I still very much recommend that review to anybody who wants to launch an investigation or launch their own journey into arts and health. It's a very good reference point. It's not a systematic review, it's a scoping review, but it gives you a very good flavor of the kind of work that goes on in arts and health and the depth and variety of research that has been taking place. Since then, at WHO, we've been very active in trying to not only look at evidence generation and evidence synthesis, but creating evidence as well, creating implementation projects. I think for so long we've kind of been stuck at the level of creating evidence, and really now it's time to also implement and to see how these projects work across cultures, across countries. So we've been running a number of research projects together with our partners, the Jameel Arts and Health Lab, in a variety of countries, not only in Europe, but across the world. And maybe it's also worth saying specifically that this year, or rather last year, we began on another sub-journey within the journey, together with the Lancet, where we're hoping to publish a series on the health benefits of the arts. Now, for those of you who are not so familiar with the medical landscape, the Lancet is probably the predominant medical health journal. It has a very wide circulation amongst practitioners, health practitioners, public health people, so the fact that they're interested in arts and health is also a very good sign, a very healthy sign that the field is broadening. So what are we doing specifically in mental health? Well, I'll pause for a moment, or I'll take a moment to explain one specific project that we're doing, which I think speaks to a number of the issues that have been raised today in relation to public health, but also in relation to inclusion. And that project is called AIM Greenland, Arts and Health, Arts Interventions for Mental Health in Greenland. For those of you who are familiar with the landscape in Greenland, Greenland has the world's highest youth suicide rates in the world. And we have started a project with a school in Greenland to work with young people on a project, on an arts-inspired project, to help improve mental health and mental well-being, with the aim, the long-term aim, of hopefully having an impact on youth suicide as well. But the primary aim here really is on increasing well-being and mental health. And I think what's really important, going back to what the commissioner said earlier, is that this is not just a project about young people. This is a project with young people, and that is very complicated. I think we underestimate not just participatory approaches generally, but participatory approaches with young people. They have their own timelines, they have their own priorities, they have their own way of communicating. And I think for us to truly co-create a project and to work with young people on mental health projects requires a very genuine collaboration. And I think, in fact, the arts and cultural engagement are a space where that kind of collaboration is more possible, where it's easier to be truly co-creative and truly collaborative. So I think this is a project that we're very proud of, and we're hopeful that by the end of the year we'll have an intervention that we will have co-created with the young people, and we'll be evaluating the effect of that across a period of several months. We're also in the process of putting together a large meta-analysis on the impact of the arts on non-communicable diseases, within which we include mental health. So this is a so-called umbrella review that has identified 150 systematic reviews. Again, for those of you who are familiar with this terminology, systematic reviews look at a variety of studies, primary research, and this is an umbrella review over systematic reviews. So 150 systematic reviews that have all got something to say about non-communicable diseases. And in that space, we have, so this hasn't been published yet. I can't go into the details too much. It's been accepted. It's going to be published by Nature Behavior, and hopefully it'll be out in September. But we can show medium effect sizes on mental health conditions. Now, when I say medium effect sizes, that might not sound tremendous, that we might be looking for large, extra large effect sizes. But in fact, in this space, medium effect sizes is often the best that we can do. Medium effect sizes are the kinds of interventions that we already roll out in terms of pharmacology, in terms of psychiatric therapies. So being able to show medium effect sizes in this space is very good. And in fact, the obtained effect for depressive disorders was larger than the effect sizes reported by psychotherapies and pharmacotherapies. Again, this is research that is just coming out, and there's still a lot of space, a lot more to be done in this area. But I think the signals are that we need to take these kinds of activations very seriously. We need to take arts and health, arts therapies very seriously. We're hoping to take all this information, the umbrella review, the work that we're doing in Greenland, a scoping review that we're doing on arts and mental health. We're hoping to take all of that and publish a policy brief on this topic towards the end of the year, where we're looking to bring together the evidence base for arts and health, arts and youth mental health in a succinct publication that we can show to policymakers and hopefully get them to act on some of the recommendations. And we're hopeful that together with our colleagues from Culture Action Europe, with our colleagues at the European Commission, with the work that is happening at the Open Method of Coordination, which was also mentioned earlier, we can really spotlight the importance of arts and health generally and arts and mental health specifically. Now, I probably already talked too long, but I do want to spend a couple of minutes going beyond arts and health and say a few words about arts and population health. Up until now, I think a lot of our research, a lot of what we've been saying has been focusing on the individual level effects, on perhaps group level effects, maybe even community level effects. But I think what we're beginning to realize more and more is that the arts and arts engagement and cultural engagement can actually have population level effects. We're beginning to work together with a group of academics, including Daisy, who you saw earlier, on a report that will follow up our 2019 report, which is investigating the data that is coming out of long-term studies, of longitudinal studies, which I think is beginning to show us that just engaging in the arts and just engaging in culture is a form of health behavior, just like physical activity and just like eating healthily. And I think that is the next big conversation that we need to have. If we're trying to convince governments, if we're trying to convince individuals, funders, that it is important to fund culture, this is an important element that we think we'll be able to say, that culture is good for you. We've been saying that for years. So I think we all know it inside. We know it intuitively. But this is evidence that we have at the epidemiological level that it is in fact something that we think is true. So I think I want to leave you all with 3 points and 2 suggestions. The 3 points are, of course, I'm here advocating the benefits of arts and health. I'm here to some extent. I have 5 minutes time. I'm cherry picking some of the evidence, and there is still a lot to be done in relation to building the evidence base. But I think most people will now agree that the arts in general and culture in general has an important health benefit, has an important health effect. And that is the key thing that I believe that we need to hold on to. The other thing that I want to say is, although we still lack a lot of evidence in this space, there's an increasing amount of research that's showing that the cost benefit of arts and health is significant. So the fact that in the UK, for instance, the Department of Media, Culture and Sport recently published an evidence summary on this topic, which concluded that the economy saves 9 billion Great British pounds through its arts and cultural activities in relation to public health. 9 billion Great British pounds. So the cost benefits, while there's still a lot to be said and a lot of research to be done, again, the indications are there that it has a significant cost effectiveness. And finally, I want to say, in terms of those 3 points, the risks are incredibly low. Of course, we have to guard against investing in interventions that are ineffective. We have to make sure that money is well spent. But in the words of Bob Marley, one thing about music, when it hits you, you feel no pain. I leave you with two suggestions. As I mentioned at the beginning, I was here 2 years ago, and a lot has happened. We've had the OMC, we've had investment, we've had a growing of the community of practice around arts and health. This room is full today. A lot has happened in the last 2 years. But one challenge that we still have is that the two sectors, the culture sector and the health sector, still find it challenging to talk to each other. And this is really something at the EU level, at country level, at regional level, at local level. It's something that we have to continue to try to break down. And the other thing that I think we have to really embrace more is the kind of thing that we had just now with the cultural intervention, the artistic intervention in itself. I think this got the loudest applause probably of the day. We have to tap into the power of the arts to demonstrate the power of the arts. Last year, I was involved in a week-long celebration of the arts in Scotland, Healing Arts Scotland. I was amazed at the degree to which that intervention shifted the needle, the conversational needle, both in terms of the public, but also in terms of policymakers about what is possible when you integrate the arts into health. Celebrating the arts is the best way that we can show its impact on health. So I'd like to leave it at that, and thank you very much, and pass back to the floor.
Thank you very much, Niels. Actually, in Australia, there is this campaign about good arts, good mental health, where they say you need 2 hours per week to engage in artistic activities. And it's very important to say as well, you don't have to be good at arts for arts to be good for you. And now I'd like to give over to Stine Keiding, who is leading a huge arts and prescription Interreg project.
Yes, and thank you very much for me joining you today. I'm very happy to be talking to you a bit about the intervention arts and prescription that is becoming more and more popular across the world. And I will talk a little bit about what is arts and prescription, and especially talk about the project that I'm leading that involves 7 countries in the Baltic Sea region and includes partners from municipalities, regions, universities, education and training schools, NGOs, and intergovernmental organizations. Together we have in 23 and 24 piloted 24 programs, AOP programs in 8 sites in Denmark, Poland, Germany, Latvia and Sweden, and we have also been evaluating the results of these interventions. Arts and prescription, as it has already been said today, is a model of the broader term social prescribing. And social prescribing is a model that connects people to a range of non-clinical services, such as exercise activities, nature walks, reading classes in the community to improve the health and well-being. And social prescribing is also growing globally, and as we've heard many times today, it is, for instance, due to the fact that we cannot only provide people with medicine and therapy. We need a more holistic approach to mental health services. And AOP is one of them. It's a non-therapy community-based program for persons who have or are at risk at developing mental illnesses. So it's also an intervention that is talking into this preventive agenda that we are also talking about today. It's group-based culture and arts activities that can serve as a supplement to traditional mental health care, or even as an alternative offer to those who do not benefit or dislike the traditional care offers. in the 1990s, England introduced the first AOP model, and since 2000, a lot of countries have been working with AOP, such as Australia, Greece, Sweden, and Denmark. They have been tested and implemented somewhat differently. In some countries or some areas, people are offered the same arts activity once a week. In other programs, they are being presented for several arts categories and meet for 2 or 3 times a week. And in the Baltic model, we have created like a generic concept that can be adapted to different local needs and circumstances. So we have invited groups of 8 to 12 people into a program of 8 to 12 weeks length. And the participants have met 1 to 3 times a week and have tried out different arts categories. It can be shared reading, it can be singing classes, dancing, like we just experienced. Sometimes people feel a little afraid of the dancing activity, so that's actually an activity we usually introduce to them a little later in an AOP program, when they feel safe and secure and have grown their self-esteem. We have tried it on many different target audiences, actually, both for only young people and for mixed age groups. Only men groups, we have also tried that one for them, because it usually attracts women more than men, but once the men are engaged, they become the best ambassadors, actually. We have tried it on also refugees, elderly people, and disabled people, and the results that we find are similar. I will come back to that in a moment. The way that a participant is being introduced to an AOP program is that they usually seek help through a referral channel. It could be the GP, it could be a psychotherapist, but it could also be the school counselor, who, if they think that an AOP program might be beneficial for them, send them to a so-called link worker or a coordinator who will tell them more about the AOP program. And if they, based on this meeting with the link worker, finds that AOP seems like the perfect fit to them, the link worker will then actually follow them to the arts activity as a steady person throughout the whole program, to make them feel safe and secure and supported all the way through. Then they participate in these activities, and then hopefully in the end they go out and look at the society in a more positive way. And we have just ended our evaluation, so now the evaluation teams is looking at the results. But what they already find is that our AOP program, like other AOP programs, can support participants in many ways. They can improve their mood, strengthen their self-esteem, support their learning and emotional skills, enhance social interaction, and a lot more. We also have some preliminary findings in our quantitative data. It's a little difficult to see here, but basically the green colors on the left side show how many of the participants that felt they had moderate to high mental well-being when they started. And in the beginning, the baseline was less green than in the end. And on the right-hand side, we have showed a figure of how many people in the beginning felt that they had felt anxiety, and it was the dark green side in the beginning, where most of them, or more than 50%, felt they had anxiety, and it was less when those 8 to 10 weeks had ended. And our study in our project, which is quite small, paints the same picture as other studies. I will shift to the next slide because we're running out of time. But generally, I would say that AOP is a good investment for many reasons. Of course, because it improves the mental well-being of participants, but also because it has societal effects in a positive way, because it can lead to economic efficiency, as we just heard. It is a low-risk intervention, as you mentioned, Niels. And of course, again, it provides a non-medical approach to mental health care, and that is good because a lot of people don't seek medical treatment and feel more safe in other interventions. So we need many interventions to address mental health issues. And one thing that we have also found in our project is that a lot of people think this sounds like a really great intervention, but how do I start? How do I set up such a program? How do I finance an AOP program? So in the project, we have created what we call an arts and prescription guide. So as you also mentioned, we have a lot of evidence out there, but we still lack the skills of actually putting it into practice. So hopefully this guide will help public authorities to start up AOP programs. And we have different entry points, just shortly to say that if you, for instance, are a link worker or project manager who will set up an AOP program from A to Z, you can look into themes of how can you evaluate the programs, how can you fund them, how can you set up an organizational framework. For the decision makers, you can read why AOP is worth the investment. We have provided some policy recommendations primarily at a regional and local level, because this is how we have tested the AOP program, and this is where the AOP programs are often started up. And yeah, if you want to dive into the guide, you can take a picture of the QR code, and then I also just want to mention that I have put a few arts and prescription brochures out there. I can see that some of you have already taken some of them. That's good. If we are running out of them, you can also find them on our project website. But it's actually giving you a good insight into why AOP programs are worth investing in, and how they are set up, and the results they can give.
Thank you so much, Stina. We really appreciate your intervention, and we hope that other other Interreg projects will be following your project as well. Next, I'd like to move to Karl Lavo from Gamian Europe, who will be talking about the Vibrant Mind project.
So, hello everyone, and to those of you who maybe don't know myself or the organization that I work for, I'll just quickly give you a small insight into it. So basically, Gamian Europe is a kind of classic Brussels-based organization. We're an umbrella organization for all the different mental health patient organizations across Europe, the EU and beyond. So we've got around 60 members, and we are working with all sorts of different mental health conditions across the spectrum. We kind of have three areas that we work on very quickly. One is the awareness sort of area, raising awareness around mental health conditions, around the stigma that people who are probably affected by it the most feel. The second is research. So we're involved in a lot of research projects, EU-funded research projects, and fundamentally there, the idea is to make sure that the patient's voice is represented throughout, not simply a checkbox at the end, but to make sure that we're really doing meaningful co-creation. And last but definitely not least, we work in advocacy. It's been mentioned a few times before, but obviously we are particularly happy about the Intergroup for Mental Health, which we co-run the Secretariat with Mental Health Europe. And a little plug, for those of you who are around a little bit later, we actually have an event, our first event today, which we're all very excited about, at 4 p.m. I think the in-person places are actually full, but online definitely you'll be able to find, and it should be a really cool event. So going straight into it. So what is the Vibrant Mind? Well, the Vibrant Mind was a project that was held between 2023 and 2024, and it was a project that came from the want of our organizations to organize an art project across Europe. And so it was one of the first art projects that we were able to see organized by people with mental health conditions, for people with mental health conditions, in a truly sort of European, pan-European way. So it went across 10 different countries, which I'll show you in a minute. And the idea was basically that 30 winners were selected. And it may be almost not contrasting to what some of the other panelists had said, but the idea here for us was to select the conditions were if you had a mental health condition, you could enter it, but then after that, it was solely based on basically how good your art was. And I'll go into this and why we decided to do this a little bit later. So we were able to collaborate with a lot of partners across Europe. Of course, when you're organizing something as logistically challenging as this, you need people on the ground in all the different European countries that you can. And yeah, this is basically our journey. I won't go into it too much, but basically we went across 10 different countries, and it was a kind of myriad of different hosting places. So it went from places such as psychiatric hospital galleries all the way through to, for example, NGO headquarters, to actual galleries themselves. And yeah, it went on, as you can see, for around a year. So getting into it, first we'll go through, I won't show you all of them, but we'll go through, I think, some of the kind of the key places that we thought that it went to, and just to kind of highlight how important and how interesting this particular project and art in general as advertised by Mental Health is. So the first, we kicked it off with an event in Croatia, in Zagreb, which is, for those of you who live in Brussels, it's very similar to the museum night that we have over here, where the psychiatric hospital itself over there opens up a gallery that they have to have people come around. And we were able to kick it off there and have the 30 artists displayed their artwork there. Next, or a little further along the way, it was really interesting to kick it off in Romania. Now in Romania, again, it was a gallery within a community care psychiatric center, right? And so this was highlighted by the people who were working there, were lots of people with lived experience, bringing in different people from general society to try and basically, in this particular one, their big theme was to really destigmatize, right? To destigmatize all the things around art, all the things around mental health. There's a couple of pictures from it there. Next, or a little later on, we went to Italy and we went to Bologna. Now, in Bologna, it was fantastic. We were able to team up with a group of people from art therapists all the way across through to an art collective called Dare to Care. And they were a group of really fantastic young advocates for mental health and art who are working on all things sort of related to that. So I would highly recommend, if you are looking for people who are specifically involved in mental health and art, Dare to Care are really, really good. Next, we went across to Hungary and we went to the beautiful city of Budapest. And here in Budapest, we basically were able to host the exhibition in a small little saloon along with a documentary for people living with disability. So the main theme here was to really try and look at the different disabilities that are created by people who have physical disabilities versus psychosocial disabilities. And then one of the last places, of course, we had to do it in our own backyard was in Belgium. And here we were really, really lucky that we were able to host it, again, in a fantastic place that if you haven't had any contact with, I would highly recommend it. It's in Ixelles, and it's the PSC Center. And it's basically a community center for psychiatry, and it's one of the first community centers that's not in the hospital complex. And there, and it definitely is testament to, at least in part, how well Belgium is doing on mental health. We were able to get the mental health minister, Frank van der Broek, I think, who was there along with other experts with lived experience to come in and celebrate the whole Vibrant Mind process. So what did we learn? So there were a number of different things that we learned across it, and I think it was interesting definitely hearing some of the other organizations talk, such as obviously the WHO. They have a very wide-reaching kind of ability and resources. I think for us it was really interesting to see from the patient's point of view what was really important. And I think one of the things that kept coming up time and time again from our different artists and our different patients were culture reaches where services can't. So you'd have many young people, especially some of the young people who were migrants and artists, who had told us that they actually felt too stigmatized to go to a clinic itself, but they didn't mind actually sharing creative initiatives, and they didn't mind becoming involved in creative initiatives. And as we've heard from before, the plethora of quantitative and qualitative evidence of how much it helps, it really is important for these sorts of people who are maybe a little bit more on the fringes. So I think we can say that, I think it's safe to say that creative initiatives act as a gateway for creating space to reflect, share, and sometimes even seek help. Another thing that we noticed was that something that we said that is that art restores dignity. when people were looking and creating these sorts of things, the participants spoke about how much the painting, the sculpting that they did, the storytelling helped them being seen and helped the actual lens being shifted away from being a patient and actually to being an artist. And this is actually why we insisted at the beginning that the whole project itself was done on talent. You know, there was the prerequisite of you having had some form of mental health condition, but after that it was really on trying to make sure that you can shift the identity across of being someone with a mental health condition to actually being an artist. And finally, community matters. At each location, the reason that the exhibitions worked so well and the reason that the things seemed to go so well was it brought people together. And this was often across different ages, different cultural background, different ethnicities. And I think this relational aspect of the art, which has the power to connect, is deeply therapeutic. And it was one of the things that often can be actually missing in traditional care. So just very quickly on what we think the policy implications should be. And most of them have been covered before, so I can rattle through this. But basically, yeah, recognition of culture as an essential component for community-based care, and particularly community-based mental health care. Sustainable funding is the one that seems to come up, but again and again, and absolutely it's necessary. Sustainable funding for participatory art programs led by those, this is really important for us, led by those with lived experience. Collaboration across sectors, health, education, youth work, and the arts, as my colleagues have previously mentioned. And inclusion of culture in EU mental health frameworks, again, as mentioned. Hopefully, when we finally do get a strategy, fingers crossed, there will be something there. And I'd just like to quickly leave you with a couple of quotes from some of our artists. So, let me go. Oh, it's up there. Hold on. I'm just going to get my... So just two quick quotes. I think one of our winning artists, a lady called Suvi from Mitian, that's her from Finland, that's her art piece there, basically said, participating in the Vibrant Mind exhibition was a validating and empowering experience. To engage in a supportive community dialogue on a mental health topic. Is that the wrong one? It is the wrong one. That's the one here. So participating in a Vibrant Mind exhibition was a validating and empowering experience to engage in supportive community dialogue on mental health, a topic which is so frequently stigmatized but affects so many lives, including my own. And I'll go back to this one. The Vibrant Mind exhibition made me feel that I was seen and appreciated. That was the first time that I felt I was an artist and that my art mattered. It encourages me to continue creating art, to use it as a social media influencer. At this point in my journey, it is now my turn to help others and to give them hope. So I think fundamentally that's kind of what we saw across there, was these people felt so empowered by being seen as an artist for maybe the first time in their lives, and that they were actually really willing at that point to give back. So I'd like to thank you all very much for your time, and yeah.
Thank you so much, Carl. And actually, we found Carl independently of the culture and health area. So it was really a bottom-up from their organization. And it's great that you have similar findings that others have as well. So next, I'd like to go to Dr. Larisa Zbranka, who is the lead author of the Culture for Health report. And we hope she will bring everything together in her last presentation.
Thank you. Can I get the presentation? Or I just need to, okay. The other way around, okay. So, thank you, Cornelia, and thank you, everyone. I think we already have a very good framework for concluding the first two panels of this morning. First, we heard how important it is to engage with the arts as an act of health promotion and prevention of disease. And probably this is one of the key messages of today, if I could highlight, even if we are now in the second panel speaking about management and treatment of disease. Because as you may know, it's less than 3% of the EU budget that is spent on preventive care. And of course, it was said before, prevention needs a long time to really give the results, but there is a huge difference in what we could say the landscape of mental health in Europe could be if we invested more in preventive care. But now talking about management and treatment of disease, maybe one thing to say is that, and you've heard from the different presentations, there's huge evidence, there's a strong evidence base, and
obviously there's space for more and more detailed evidence on the mechanisms through which arts produce these important effects on health and well-being. But now, arts in itself are not the treatment. So I think we are not running here in a competition with the healthcare system. Yes, it's a complementary type of care that you can see from the evidence presented already that it hugely supports both the health system that is already overburdened, that it faces shortage of staff, and a lot of threat also on the mental care and the health in general of the people in all sorts of care jobs. That this type of support that can come from engaging with arts and culture of both patients and people in this type of caring jobs could be significant and changing completely the way in which we can, on a longer term, envisage health, so that as society we are looking at the people's potential to thrive as a definition of health, as actually it is framed by the definition of health by the WHO, that this really becomes a reality. I wanted to briefly come through the evidence, and I will not mention what has been already said, that there's a lot of evidence around the fact that arts engagement in particular, so those activities where people are engaging themselves without having to have a specific talent, engage in dancing, in singing, in drawing, they bring positive effects to people's mental health, and that comes to reducing symptoms of anxiety and depression, but it has also an important effect in the social inclusion of people dealing with mental health conditions, and also reducing stigma and creating a more embracing, let's call it so, type of social attitudes toward people that are facing mental health. And the fact that it helps people renegotiate their identity, it is, I think, a hugely important factor. But I think it's also important when we think about the management and treatment of disease to look at other type of chronic disease, that people that live with long-term conditions, be them neurodegenerative conditions like dementia or Parkinson's, that are hugely affected with mood swings, with depression and anxiety symptoms. These can be alleviated through arts participation. And as said before, the carers, their own mental health and their burden of care can be lifted through this type of participation. But you can also imagine someone living with cancer. They will not get cured by cancer by participating in arts activities, but they can find ways to cope and accept their condition, find, again, positivity, find positive things in life, which we already know are really important in how, in general, the recovery pathways are progressing. And already have been speaking about taking care of caregivers, and I think it's important to think of caregivers not only as people working in social care and in health systems, but also people working in the education field, and artists themselves, those that are now siding with healthcare workers to engage in this type of activities. And one also important point, we have been speaking about the importance of keeping people in workforce with increasing stress and burnout rates. And I will just briefly talk to you about an 8-week intervention project that we did in Romania in the late 2020. So it was during the pandemic. You can see from the pictures people had to keep a distance and wear a mask. But these interventions that included different types of cultural activities helped people that had, at the beginning, high burnout scores, at the end of the intervention to have low to medium burnout scores, increased well-being, And we also had measurements 1.5 years after the intervention, and people were still using coping mechanisms based on art participation that they learned during this intervention 1.5 years after. When they felt that the stress is kicking in too hard, they were increasing their cultural participation as an effect to lower their stress levels. And just to conclude with some avenues of acting at policy level, I think it is really important, as it was already mentioned, it's really important to move from this level of project to systemic impact. And we have evidence, we have really thousands of incredible experiments and pilot projects happening throughout Europe and in the world. But now we need to see how we can make this accessible to everyone who suffers of mental health conditions, to have in their communities access to this type of interventions and to cultural activities to benefit of this alleviation of their symptoms. And one of the recommendations that we make is to integrate culture into EU and national comprehensive mental health strategies and generally into care pathways. And I think here would be highly relevant when we speak about policies that are focusing on mental health of the youth or the workforce or the caregivers. To create a EU mental health strategy that is recognizing culture as an intervention area, and I think this is already on the agenda that as we have been speaking already today, to establish a cross-DG mental health task force that would include resources and specialists from health, education, youth, and culture, to launch a youth mental health action plan that puts cultural activities at the center of, or at least giving an important role to these activities. You can imagine, for instance, having cultural activities included in the school curricula in a way that young people's stress, sometimes difficulty to concentrate could be managed through either short-term interventions during their mathematics or physics class, like 5 minutes of singing could change, shift the mood into a class, but also by engaging in art-related classes in the school. Launch the Youth Mental Health Action Plan and act upon the wider recommendations from the Culture for Health report. I think there's no time now to go into more details, but we encourage you to look through the policy recommendations of this report, which is, I think, on your tables or you find around in the room.
Thank you very much, Rarica, for bringing this all together. I think for the reason of time, we would give over to the third panel now, which will be about women, the intersection of mental health and women's well-being in a changing society. I don't know if, Niels, you want to come in the middle? Thank you so much.
More, because I can move forward if there's any coming. Then let me switch so that's Johanna. Yeah.
Hi, I'm Niels. Pleased to meet you. Thank you so much. Yes, I'll
Hello.
The one non Okay, I'm going to suggest that we start off rather quickly because it's been such a fascinating and interesting day that inevitably we've run behind a little bit, and we want to make sure that we give everybody proper time to speak today. So you already know who I am. You probably can see that I'm the only, that I'm a man, that I'm a male chairing a panel about women's health. So I take that privilege very seriously, and I thank you very much for allowing me to be part of this conversation. What we're going to do today is have a conversation both at the broad level around women's health and the importance of women's mental health as well as at the specific level about what an example of a project related to postpartum depression that we're going to also learn a little bit more about. And then we'll have the opportunity to have 3 MEPs who are sitting beside me on my right here to give some comments, some thoughts, some insights, both about what they've heard, but also perhaps what they think they can enable and encourage within the European Parliament. So I'm going to briefly introduce all our speakers now, and then I'm going to have Johanna kick us off. So, Johanna, is it Shima or Schema? Shima. Johanna Shima serves as the head of the European delegation and vice president of Make Mothers Matter, an organization dedicated to promoting the well-being of mothers and families. Since joining MMM in 2014, she's worked extensively on advocacy efforts to influence European policies, focusing on gender equality, maternal health, mental health care, economic empowerment, and family support programs. Following Johanna, we have Ravita. Ravita is a cultural expert with 25 years of experience in arts management, curating, research, and advocacy. She's the program director of the Kulja Culture Center in Romania, where she has also been a key partner with WHO Europe, in fact, implementing a project called Music and Motherhood, which I'll say a little bit more about in a moment. Then on my right, we have Eleonora Meletti. She's a member of the European Parliament since 2024. She's the EPP coordinator for the FEM committee, advocating gender equality, women's empowerment, and the fight against discrimination and stereotypes. And she promotes mental health awareness as well. She also serves on the CULT and employment committees, contributing to legislation on education, media policies, and social affairs. She has a background in journalism and media. She is the author of 2 best-selling books. And in her first book that she received a special mental health award for by UNESCO, Ms. Meletti explores the often overlooked challenges of motherhood and uncovers the mask of social expectations of the perfect mother. And I'll say a little bit more when I introduce Ms. Meletti about what she's going to be talking about in this panel. We're also joined by Gabriela Gergeni, who's a member of the European Parliament since 2024, where she represents the Hungarian TISA party within the European People's Party. She's the vice chair of the Committee on Regional Development and a member of the FEM committee, and she brings a valuable perspective to our panel today on how regional and gender policies can support mental health and well-being, especially in rural areas. And last but certainly not least, we have Tilly Metz, who's a politician from Luxembourg and who joined the European Parliament in 2018, representing the Greens EFA political group. She's been a strong advocate for animal welfare and health-related issues, as well as human rights, and she's also worked extensively on public health, including rare diseases and disability rights. In 2024, she became the vice chair of the Sant Committee and remains an active member of several parliamentary committees besides. So I'm very pleased to have a great representation from the European Parliament here across several committees that are here. And I'd like to now give the floor to you, Johanna, to kick us off with an overview.
Thank you, Niels, and thank you for inviting us to this important event. I would like to speak about why, if we want to ensure healthy children, adolescents, and adults, we must prioritize maternal mental health. So I will change the slides here. Yes. So let me begin with what we have already heard, that mental health problems affect 1 in 6 people EU-wide, and this covers 80 or amounts to 84 million people. But what is perhaps even more alarming is that 1 in 5 women globally will experience a mental health condition during pregnancy or after after giving birth. And yet, despite this reality, maternal mental health remains invisible and is a hidden pandemic. As Dr. Alain Gregoire says it, depression is the #1 complication of maternity and tragically also is a leading cause of maternal death, compared to hypertension, PPH, that's postpartum hemorrhage, diabetes, preeclampsia, etc. According to Professor Anagano, up to 70% of mothers without early intervention go on to develop persistent symptoms, often lasting beyond the first year after delivery. This burden is even heavier on younger women and those with a previous history of mental conditions. Studies show that if a mother experiences mental health issues, depression, or during or after pregnancy, her child faces a double risk of emotional or behavioral problems later in life, and that her ability to bond with the baby may be impaired, and that the chances that she has in the future for future mental conditions increase significantly. A study shows that the adolescents that presented depression symptoms at the age 16 all had mothers who have suffered or presented depression during their pregnancy. And for the cohort mothers who responded to this, who were analyzing this in this study, who did not report depression symptoms, none of their teens reported this either. So we also know that early emotional adversity or poor mental health can be transgenerational, that goes even beyond further generations. At MMN, so Make Mothers Matter, we recently conducted a survey of 12,600 mothers in 11 countries plus the UK. And what the mothers told us is striking. 50% of the mothers suffer from mental health problems. Those are depression, anxiety, burnout, peripartum depression. 67% of them report feeling overload. And there I want to link with MEP Kulja, who was talking about work-life balance and these family dynamics that stresses and puts an impact on mothers. Here we see, maybe you see it if you have the app, or the countries where mothers feel more overload. Portugal is leading these countries in our studies. Spain, Ireland are the three main first countries. Then here you see some statistics on anxiety, with Spain leading, depression, Sweden, burnout, Belgium, postpartum depression, Belgium. So we also ask mothers what helped them in these situations. And they named the main three answers that they gave were help from partner, friends, or family, taking more time for myself as a second condition or something that helps them, and exercise. And you see the others, or you can, I don't know if you can see them. They go beyond there. So mothers facing mental health challenges emphasize that taking time for oneself and help from family is crucial for their well-being, but only 51% of these mothers stated that they had not enough time for themselves. So often they feel that there is no support available, and this is what some of them said in our survey. Nobody supported them. I just had to get on with it. Nobody supported me. I always looked to myself for the strength to get through this. So why this should matter to all of us? Because women who are mothers represent a very significant segment of our society. Additionally, when we talk about mothers' mental health, we just not talk about them. We are talking about her child, her family, her community. And mothers are our society's primary carers, and their well-being lays the foundation for future generations. So we cannot afford to look away, and especially not now. During the COVID pandemic, it has been explained also, we saw a sharp rise in perinatal depression and anxiety, and factors such as isolation, poverty, unemployment, intimate partner violence, all contributed to this. But let's be clear, there are some segments of the population to which stressors are even higher. And those are people or women of color, those of low-income settings, single moms, migrants, and all those facing systemic discrimination who bear the brunt of all of it. And while we may think also that poverty in terms of, we think of physical condition, it is often the mother's own emotions, her stress, her shame, her fear, and how she internalizes poverty that gets passed on the child. And that's where all the damage starts. This is why the European Union has to care. And also because, as we have seen it, economics matter. This neglect comes with a hefty price tag. A study published by the London School of Economics showed that the cost of just 1 year of births where maternal mental illness was not addressed and not treated reached up to £8.1 billion, and 72% of this cost was related to the child, not to the mother. So what can be done? We need strong political commitment, and we are very happy to have the floor here at the European Parliament for this. We cannot, because this is not just a medical condition, just is not a personal issue, this is a societal issue. We need to make maternal mental health as an essential part of maternal health and not an optional extra. Because as we know, pregnancy is a time of great change and increased vulnerability, but it's also the great opportunity where many mothers, or most of them women, come in contact with the healthcare system, regardless of their background or access to resources. We need to provide accessible, affordable, and integrated services, especially for those facing social inequities. We need to introduce clinical guidelines and screening tools to catch these problems early, as, for example, we were partners of a EU project called Rise Up PPD, postpartum perinatal depression. We need to ensure perinatal mental health training as part of the health training for all professionals in spite of their specialty. We need to allocate, again here, more funding, sufficient funding to invest in prevention, monitoring, and community awareness. We need to address all those social determinants such as gender discrimination, violence, lack of social support, social economic status, like poverty, substance abuse, natural disasters. We need to support breaking the silence on maternal mental health and stop leaving the mothers in suffering alone. We need to listen to mothers and support their voices in shaping solutions that work for them. We need to raise awareness and support efforts to reduce stigma, because this, as I said, is a collective responsibility. Somebody from this room told me that there is a Hungarian saying, very old saying, that mothers are the fire of their houses, of their homes. So let's take the first step to lifelong well-being by finally putting maternal mental health where it belongs, at the heart of our health systems, our societies, our policies. And remember, if a mother suffers, a child or a baby struggles, the teens break, and the societies pay the whole consequences of this. I would like to invite you to, this is not the last slide. Okay, so I would like to bring your attention to some materials that we have done at Make Mothers Matter, which is a series of videos with experts on breaking the silence of maternal mental health. I would like to ask you to invite you to sign our petition on ending the maternal mental health crisis that we have also on our website. You can consult also on our website our survey, European Survey of Mothers. You have seen maybe or some flyers of a project, EU project, where we are working with partners on mothers with disability, a very under-researched population, working on physical and mental disabilities, where we are trying to study the specific situation and in order to prevent stigma and discrimination. And I would like to show a little call from a partner organization who's working on perinatal mental health and an organization of child mental health who's calling to support, to stop the unnecessary separation of children and their families In Spain, there is a practice, but apparently it's been done in other countries, where due to mental health issues, past, present, or because of mothers having been suffer violence or have grown up in a foster care, or because of lack of societal support, their babies are removed when they are born. So this partner is asking to change this model of presumed maternal inadequacy and change that old model with a caring, evidence-based and interdisciplinary approach that prevents unnecessary separation. The video, I don't know, Danai. Yes, thank you. You had it there. It's in French, sorry, but I just explain what he says.
Chers amis, je m'appelle Pascual Palau-Subiela et je représente l'Alliance hispanophone pour la santé mentale périnatale et de la famille Conecta Perinatal et la filiale espagnole de la OIM, Association mondiale pour la santé mentale des enfants. Je m'adresse à vous pour attirer votre attention sur l'importance de prendre grand soin de la santé mentale périnatale et en particulier de la santé mentale des mères et des familles qui ont de grandes difficultés à développer leur maternité et leur paternité. Des circonstances et des arguments différents servent souvent à leur retirer la garde et la tutelle de leurs enfants qui ne pourront plus grandir au sein de leur famille. La maladie mentale actuelle ou passée d'une mère, une enfance malheureuse pour avoir souffert maltraitance, avoir grandi dans un centre de mineurs, un manque supposé d'attachement pour entourer d'amour à son bébé, un manque de soutien sociaux sont quelques-uns des nombreux arguments utilisés par les services sociaux pour leur retirer leur bébé quand, aujourd'hui, il existe déjà suffisamment de connaissances et de ressources sanitaires et sociales spécialisées pour pouvoir s'en occuper et, pour la plupart des cas, éviter la séparation traumatisante à laquelle sont exposées ces familles. Nous vous demandons de nous aider à changer cette situation non seulement en Espagne, mais aussi dans les pays de notre environnement européen et d'Amérique latine. Vous pouvez appuyer notre manifeste pour soigner les familles en difficulté. Merci.
Thank you very much.
Thank you very much, Johanna. We're going to move over to Rarita. One thing that you said that I think is very important is to listen and support mothers on what works for them. And I think the project that Rarita is going to talk about now is a project on postpartum depression, working with mothers who are experiencing postpartum depression using music as a form of group therapy in ways. This was part of a WHO project which was implemented in 3 sites in Denmark, Romania, and in Italy. And Rarita is going to say a little bit about how it was implemented in Romania. Over to you, Rarita.
Well, thank you. Yes, indeed, this is an example of how an intervention that has been already implemented across the globe. It started in UK, it has been researched, and it has very strong research and even a protocol that can be found and replicated in other countries and in other settings. Exists this type of intervention that is based on group singing for mothers that have symptoms of postpartum depression. Has been initiated as a pilot project, as Neil said, by the WHO in Europe, with the hope to test how this type of intervention would work across different cultural settings. And Romania was one of the contexts. Italy and Denmark were others, and other countries are currently preparing to also embark in such a journey. The intervention itself consisted in a number of 1-hour meetings of a group of mothers with symptoms of postpartum depression. They met with an artistic professional, a musician, that led the session, so it was an artistic intervention. And they met for a number of 10 consecutive weeks. And the idea, what differentiates this type of intervention from others, like for instance in Romania you would have a lot of activities for mother and child, but this was the only one activity that was focused on the mother, so on the mental health of the mothers. And this is particularly what all the women participating in our project have mentioned explicitly, that it was the only place where they could find support and the opportunity to meet other women that were facing the same conditions and the same difficulties as they did. And they found that these opportunities to meet once a week with other mothers and their babies were one of the rarest opportunities in that period of their life where they found joy and connection. And I think this could highlight the saying that it takes a village to raise a child, that having the opportunity to connect and be together with the others is really important. One other thing that a lot of the mothers participating in our project said that they thought they will not be selected for the project, because we did also a research. We selected as participants women that had quite high scores in postnatal depression, and they all perceived their situation as not being so severe, though by the psychometrics it shows that they were having postpartum depression. So it also says how important it is to be together, to be able to see each other and encourage each other, and also the fact that mental health it's an invisible condition, so we may not be able ourselves to identify that we need support and reach out for support. The intervention itself engaged mothers together with their babies, and what they did was they were singing songs without any lyrics. They were singing songs that, from pop songs to lullabies, but also they were kind of making their own song. Again, there was no musical experience before, and there was a strong connection between the mothers and the babies that had developed during these weeks of singing together with the babies. And they also found really useful that they could take home some of these exercises. They could sing at home to their babies, and this is a bonding factor. We had a Romanian language group and a Hungarian language group in Romania, so we could also experience with different musical, so different songs. Some were in Romanian, some were in English, and also we could also find some slight cultural differences in how stigma of suffering of postpartum depression is being perceived. I think the Hungarian mothers were more open to embracing such an intervention. Just to briefly show that the intervention had positive results on all the participating mothers. So the burnout, the postpartum depression scores have decreased. The well-being scores have increased, and also the scores indicating the social support have increased in the group, which shows how such interventions could be really useful and could be supporting a lot in our communities if they were scaled up. Just to understand a bit the context in Romania, there is no monitoring of depression pre or post birth as a screening method. So unless mothers or families are aware and they are encouraged to reach out for support, this is not available. Such support is not available. And the fact that this is a non-stigmatizing intervention, it happens not in a medical context but in a community context, is also what increases the chances of women taking up such an intervention. And maybe one last point about the efficiency of these types of interventions is that during this period, mothers are not so open to taking medicines, yes, because they are breastfeeding. So music-based or art-based interventions have a higher acceptability rate than other types of interventions that are based on medications. And I think this is something that could definitely be scaled up in all mental health systems. Here are some quotes from participating mothers, finding that this was contributing to their mental health significantly. I will stop here.
Thank you very much, Ravita. Maybe you can just leave those quotes up for a second in case people haven't had a chance to read them. I think they're incredibly powerful and very meaningful. We're beginning to run out of time. I'm not sure we'll have a long amount of time for discussion, but I'd like to hand over now to MEP Ms. Meletti, who will be drawing from her personal experiences and will speak today about social stereotypes and the challenges that every woman faces because of them delivering a message. Each woman should be accepted exactly as she is, with all her choices and all her emotions. Over to you.
Thank you so much. I would like to thank András and Zoltán for this kind invitation and for creating a space where we can talk about mental health. It is important to open up this conversation, and I'm grateful to have the chance to speak here in front of you about women's health, and especially during motherhood. Today I won't speak as a MEP, I won't speak as a journalist, not even as an author of 2 best-selling books on mental health, but I will speak as a woman that when she became a mother, she realized that society had been crafting carefully a narrative around motherhood that actually hides half the truth from women. I will actually read to you, I will share with you a few thoughts as written exactly on my daily diary, part of which went in public through my book, in an effort to pass on true, real emotions in their true dimensions. So please allow me. I became a mother at 38. I wasn't someone who always dreamed of having children, but pregnancy came easily from a passionate, loving relationship. We were overjoyed, and on April 13, 2018, when my daughter was born, I felt something I never knew a person could feel: absolute happiness. I fell in love with my daughter instantly. I felt like I had also been reborn, because the woman I was before no longer existed. My priorities, my preferences, even my dreams, everything shifted. The first weeks were filled with sleepless nights, constant breastfeeding, and intense emotional swings. I adored my child. I wanted to do everything by myself, and nothing else mattered. Myself, my partner, even my career, which had been my main priority for years. I could not recognize myself, my previous life. I always felt confused, like not having a clear identity. Where was everything I had been told to expect? Why didn't I feel fulfilled? Why didn't I see the world with new eyes? As I was exhausted, isolated, and ashamed. Ashamed that I didn't feel the way I was supposed to feel. Even in moments of joy, I carried something that felt like grief. I had lost my sense of self and was trapped in a daily house of conflicting emotions, raging for overwhelming love to complete despair. And I was afraid to say it out loud, afraid I would disappoint others, that I wouldn't live up to society expectations, because this is what society teaches us, that motherhood is magical, that we must bounce back quickly, return to work, lose the baby weight, and become even more desirable to our partners and even more successful in every single role we take. One morning, I woke up and I told my husband, I'm not okay. I'm not who I used to be, but I also don't know who I am. We both feared I had postpartum depression, because this is another lie of the narrative. In motherhood, either you fly to the moon or you have postpartum depression. But I didn't. What I was experiencing is something entirely normal, yet rarely discussed. It's what experts now call matrescence. That means postpartum emotion adjustment and not depression. a sensitive period that can last up to 2 years, filled with contradictory emotions, identity shifts, and deep internal change. No one had ever spoken to me about this, not at 38, not ever. Unfortunately, ever since postpartum depression was officially recognized as a diagnosis, hundreds of thousands of cases have been labeled as depression, when in reality, there was simply the woman's effort to adapt to a new reality and an effort to rediscover herself. Working with a specialist helped me understand that nothing was wrong with me. I did not have any kind of disorder. I was simply becoming a mother. Because motherhood doesn't begin the moment you leave the hospital. It begins every day with every fear, every sacrifice, every rediscovery of yourself through this new role. And I also realized something else. We don't speak honestly to women about what they might go through. Women who do not have children are completely unprepared. And those who have often stay silent, afraid to admit the darkest side of this experience. We must change that. Because women in motherhood face real psychological challenges. The clash between personal desires and social expectations. The judgment about everything, about breastfeeding, working, parenting choices. Whatever you choose, someone will criticize it. And that criticism can come from everywhere, from friends, from family, even from other women. So let me say this clearly. It's not wrong to struggle. It doesn't mean you are a bad mother. It doesn't mean that you are depressed. It means that you are just trying to adjust. And that adjustment is not a disorder, it's a part of becoming. Yes, we need laws, we need benefits and support programs, but above all, we need truth. We need to stop creating idealized myths about motherhood. Because the real experiences has everything. Joy and pain, fear and love, confidence and doubt. And it is a journey of transformation that touches the very core of who we really are. Motherhood is a responsibility towards our children, but also towards ourselves. And each woman's journey is deeply personal. Some need more time, some need more space, some need more tenderness and understanding, but all deserve honesty and support. We owe it to them to speak up, to prepare them, to educate and engage their partners, to help them come back stronger, whole, and victorious. I have been there. I know that the way back exists. So, if there's one message I'd like to leave with you today, especially for new mothers who might be struggling, is this. It is okay if you don't feel okay. It will pass. It will find balance. Motherhood will find its place, and so will you. Thank you so much.
Thank you so much for that passionate and poetic insight into your motherhood experience, and hopefully others will take from this as well. We don't have a lot of time left, but I would like to go to our two other MEPs, MEP Metz and Gargeni, and I'd perhaps like to ask the same, in the interest of time, like to ask the same question to both of you. From what you've heard today in terms of the challenges, both about maternity, motherhood, and particularly mental health challenges, what is it that the European Parliament can do in this space? And if I can ask a particular sub-question there, one of my main interests is understanding how the different sectors and different committees can work together. And is there something where the different committees can work together on this topic? Perhaps I can go over to you first.
Just before I answer your question, let me say that I'm very happy about the presentation of Eleonora, because it really spoke also to me when we were telling how life changes when you have a daughter. I must say, when my Lisa Marie came, I was separated from the father when I was 7 months pregnant, so I was alone with Lisa, but then she came, and how life-changing it is. And I found the most difficult thing to do, to be honest, is to manage our fears. Well, every time time, even when she was 5 years, but now she's 29, every time she goes away, it is managing this fear that to let her go. And I think, so I'm very happy that you mentioned the topic, and also how to learn to manage this fear by letting people live their life and letting them go. But it starts at a very early age. But to answer to your questions, thank you very much. I will buy you books, by the way.
That's a great, unfortunately.
Because it's important to waive the taboo and all this. We have to manage in there. So, yes, what we need to tackle, I think it's very important, is really to speak about the gender dimension of mental health in general. And we often forget to speak about gender inequalities. And as vice chair of both the SAN committee and also the intergroup on mental health, what I've seen, and that is good, is the growing really recognition of mental health issue. But if we want to be serious about building inclusive mental health system, we must start definitely by acknowledging the clear gender disparities that we have, considering risk factors, diagnosis, treatment, and access. So it's still kind of a taboo. And at the beginning, even in the mental health intergroup, it was the women's health group, it was. So evidence shows now today that women are disproportionately affected by common mental health problems, also because of their specific, and you mentioned one very important, their very specific also life that they and the experience they make there, and also on the physical, but also psychological. So one structural problem that we have is really that clinical research still underrepresents women, especially pregnant women, especially mothers. The result is a dangerous gap in evidence-based care. So I want to stress here the importance of integrating gender analysis in all stages of health research and policy, from clinical trials that we do to service design that we offer. The European Parliament has made important contributions already. We had in 2017 already a resolution on gender equity in mental health and research. Sadly, I must say the implementation is a little bit slow, but more recently we also had in the SANT committee launched a public consultation on women's health, which received overwhelming interest from experts, from citizens and civil society. So this shows there is real momentum and public demand, and this event shows it also, so thank you to András also. There will be a follow-up reports both in SANT and FAM committees, and I will definitely continue to advocate for strong cross-committee cooperation. So what we need, and I said it already, is better mental health disregarded by gender. We also need integration of mental health services in sexual and reproductive health care. We need the recognition, and it was definitely shown today, the recognition of maternal mental health as highlighted, as I said, and importantly, we also need to support for grassroots and civil society organizations which often fill the gaps in care and advocacy, especially for also marginalized women, migrants, communities, and single mothers. So we must see mental health not just as a medical issue, but as a gender equality issue. So it's linked also to economic inequalities, to care responsibilities, to violence, and to access to social protection. So later today, this afternoon, I will indeed continue the discussion around mental health with the Mental Health Intergroup, and we will address also the topic of social rights as core to building positive mental health. So let's continue the fight together. Thank you.
Thank you so much. And last but certainly not least, MEP Gabriela Gergeni, please, over to you.
Thank you very much. It's an honor to be here today, and I would like to thank my colleagues for the invitation. Actually, I could not but agree with Eleonora and also with Tilly, so I was basically nodding with my head. I'm a mother of 2 teenagers, so also the personal part is very familiar to me. but also I agree very much with the intentions and the actions the Parliament can make. Now, I would mainly speak briefly only, don't be afraid, from REGI Committee, Regional Development Committee perspective, but also as member of the Intergroup on Demography and a contact person to the CRPD, this UN Convention on the Rights of Persons with Disabilities. So I think all the problems and the issues that emerge in these contexts interrelate and has effect on women's situation, on mental health, also on physical health, of course. And it's a little bit dry figures or dry facts, dry statements, what we have in the REGI committee, because it's normally about money, which is very important. We talk about the funding, we talk about the financial resources which are needed everywhere to make our intentions and actions implemented and make them work. But of course, that's where we have the big fights. Now, as you may know, we are at the beginning of the next 7 years financial period of the EU. And that's the moment when the Commission comes up with the proposal and the Parliament as a co-legislator will have a say. So what are the crucial important elements that we always focus on when channeling in our ideas already in a preliminary opinion voted in the plenary session in Strasbourg, by the way, 2 weeks ago, that basic principles like gender equality, equal opportunities. We would welcome the development of a methodology which focuses differently on genders, gender disaggregated data, for instance, to see the difference between men and women in situations, but also to pay attention to the different genders when drawing up impact assessment for a new upcoming legislation. When the Commission launches an initiative, important to include not only different economic, social factors, but to have kind of, again, I would use the word gender disaggregated approach. And just about a few recent initiatives, what we have discussed last week or the last couple of weeks in the REGI committee. It's about rural areas, how cohesion policy could contribute to improving and developing rural areas, also on housing, another parliamentary opinion. And here, when we make the link between the existence of proper housing, proper infrastructure, many people say that it's healthier also in terms of mental health to live somewhere in the countryside when the nature is close and it's not so noisy and hectic like living in a big city. But if you cannot use proper public transport, if you have no hospital, no childcare facilities, then I think it will not do so much good to your mental health. So also I come back to the question of money and to the question of how the Commission on its own side and also the member states have their responsibility to harmonize the different strategies, the different sectors, and to pay attention that when we talk about vulnerable groups, including women, they have access to all those facilities. And of course, a lot of awareness raising and information exchange is needed in the society. And it's my last sentence. When we talk about the European Social Fund in particular, which pays European sources for skilling, training, education, job opportunities, in particular for women, also in order to improve their involvement in employment, in leading positions, and also to close the pay gap, which is still quite substantial also in EU level, but also in my home country, Hungary. Thank you very much again.
Thank you very much. I've been back channeling, and it seems like we might have an extra 5 minutes, or do we need to draw a conclusion? 3 minutes, 3 to 5 minutes for questions, or for a quick conversation, because I hear some very important topics and themes coming through. Obviously, around the importance of deaggregated data, about the importance of awareness raising. I think we've also talked about nuancing and not over-medicalizing, particularly in relation to motherhood, not over-medicalizing challenges that mothers will naturally experience in this space. And we've also heard about the importance of systemic changes. What we haven't heard so much about, and obviously I take the prerogative here as chair, we haven't heard so much about how culture can impact and be part of this conversation. And I say this because in the cultural space, in the kind of cultural engagement terrain, it is often predominantly women who are in this space, perhaps more so than men. If we draw the analogy to sports, we could say that sports, men are perhaps more actively drawn towards sports, and in the cultural domain, not to gender stereotype here, but in the cultural domain, perhaps women are more drawn to that space. And as we've seen from the intervention or the implementation that Ravita referred to, there is clearly a space for culture to support the mental health of women. I'm just wondering if any of you would like to kind of comment on that briefly before we draw to an end. In your experiences within the committees, whether or not there's a space to have those conversations about how culture impacts on mental health and women. Yes, please.
Actually, when we say that society has crafted a narrative around motherhood, we're actually talking about culture, because it's the culture that creates all these narratives that follow us from the beginning till the end. So I think that what we must do by raising awareness is that we should we should shift that narrative. And we must start speaking about mental health and linking the health to mental health also, because we cannot talk about health if we talk separately for physical or mental health. It's health. It's the whole. We must start speaking about mental health. We must break the stigma, because in my country it is a taboo. We don't speak openly about mental health, about seeing a specialist when you have the need to express yourself, to make to share your emotions and your feelings, and to talk about your difficulties and your challenges. So I think that we must start speaking about the importance of mental health, and that it's not something wrong. Nothing goes wrong with you if you have the need to visit a specialist. And I think that by raising awareness, this will help everybody to start seeing through a different perspective all about mental health. We must create another culture, through education and through public speaking, through campaigns. I think that mass media also must help on that. I'm a journalist. I have testimony that the power that television has on people and on forming beliefs and ideas. And I think that also social media has to play a role on that. So it's an holistic approach on how we must shift this narrative, and I think that it works working on that.
Thank you. Please, MEP Metz.
No, just very shortly to complement. I think culture is on the one side an important media where you can express emotions or situation or distress or issues. So it is very important, and we saw it at the end of the presentation before. We saw it that it is very important also in tackling or finding in therapy that you can express yourself, and that culture is very, very important. It might be by also writing a book that really helps you, but it might be by painting, it might be by music, by theater, where you can express your emotions. But on the other hand, it's also a very important tool to raise awareness to a larger public that there is an issue. You can even do it on a humoristic way. I remember a French comedian, a woman, who spoke about her mother with all those things she didn't like in it, and I laughed about it when I was listening, but on the other hand, it was great to raise awareness also that there are issues and that they should not be taboos to speak about them.
Thank you very much. Yes, please.
Sorry. Yeah, just 2 short remarks and very concrete examples if I interpret the notion of culture very broadly. I think it's also a cultural question, culture of the whole society. For example, if we can have a babysitter, because I experienced this difference between Belgium. I lived in Belgium before becoming an MEP, and whether having a babysitter here, it was just a normal thing. Having a babysitter in Hungary was much less tolerated. It was seen as something negative. Oh, you go, don't know where, do a shopping, or you go to the hairdresser and you leave your baby with an unknown person. That was something negative. I think during the past years there is a kind of development in this regard, but there was a very famous Hungarian psychologist who worked a lot with children and said that if the mother feels well, the children will feel well. And then it has an effect on the whole society. And my own personal experience that a garden can be a culture and gardening can be developed to a kind of cultural level and necessarily does good to mental and physical health. Thank you very much.
Yes, absolutely. Please, Joanna.
I agree with you with all what, and thank you very much for these very personal testimonials. I would like to say that maternal mental health is on the hand of all of us. Even if you are not a mother, if you are not a father, if you are not a grandmother, everybody can do something. If you see a neighbor who have a new baby, just offer your service to help with shopping, food, invite for a walk, take the older kid to the park. Just these acts of kindness and support matter a lot for these young couples or families, sometimes single moms. And this can make the whole thing, as Mrs. Meleti said, just they don't grow up as bigger problems. So just everybody, all of us have this in our hands.
Rarita, the last word.
That's a lot of pressure. I wanted to add one dimension to the conversation on women's mental health, and that is the huge role that women have in caretaking in general. I think it's almost 70% of caretaking roles, from education to health, and I think in some healthcare jobs like nursing is up to 90% that it's women. And as we all know, these are low-paid jobs with a lot of psychological strain, and I think putting a lot of emphasis on women, supporting women and caretakers in the next EU care strategy, I think it's really crucial. And then to build on the need to change the way in which we see the women mental health, I think is important to acknowledge that a lot of the natural phases, as it has been already said before, natural phases in a woman's life involve biological changes that generally create shift in moods and for instance, brain fog, which, for instance, in the case of perimenopausal phases, you just have to go on with your life. Nobody from outside knows where you are, but your capacity to focus and deliver is definitely reduced. Just as the same as with motherhood, how do we speak about this? A friend of ours went in Sweden to the doctor to ask about how can she prepare for menopause, and what the doctor said: if you do not have an acute condition, do not waste my time. So the question is, how do we in society start to speak about women's health and women's mental health?
Exactly, by speaking, and I think that's what we've been doing today. Thank you so much to all of our panelists for this wide-ranging discussion. I do wish we would have had much more time to discuss this, but unfortunately we have to draw the discussion to a close. Once again, I'd like to say thank you to everyone, and I'll hand over back to our captain, MEP Kulja, to draw the day to a close. Thank you.
You may sit in the panel for the last concluding remarks if you want. It will be a group picture with MEP.
I expected to stay here, but
sit next to you.
Okay.
Make you less lonely.
Okay, thank you. Thanks so much. Maybe there is
there's an extra
thank
chair.
you.
Mhm.
We don't leave you alone.
Thank you very much.
Yep.
Thank you. Thank you. Sorry for. So, their colleagues, their guests, their speakers and moderators, thank you all for being with us for the second day of our Mental Health Summit. As we conclude our 4 panels, one thing has become crystal clear. Mental health is a complex, yet deeply human. It can be both daunting and beautiful. Much like our mind themselves, our personalities, our aspirations. These conversations have shown us just how deeply mental health touches every aspect of our lives. I want to extend my heartfelt thanks to Cornelia and Mary for bringing the topic of culture so vocally and passionately into this house of democracy, perhaps for the first time in this mandate and in such a powerful way. Katie, thank you for reminding us that movement is medicine, for leading us in a rhythm and connection through music. It may have been the first time in the European Parliament, so a collective dance of the audience and the speakers at the same time in the meeting room. And what a joy was to see former Commissioner Mr. András to join us with his passion and spirit. So let this be a reminder, culture and physical activity are not luxuries. They are essential components of well-being. They are tools for connection, healing and resilience. They belong in our schools, our workplaces, in our policy planning. I also want to thank all of our speakers who shone a light on a specific mental health challenges faced by women. Thank you for sharing with courage and care about these issues that are too often overlooked. And thank you to follow MEP colleagues Eleonora, Tilly and Gabriella who shared their personal experiences. And Eleonora, your words really touched me because we have with my wife a 15-month-old beautiful son, and
please support her. She needs you more than ever.
Yes, and that's what took me time to realize that how her life has changed, and when we first talked about this, my son was 3 months old when I jumped into politics. It was never part of my plans, but I felt that I want to do something, and Peter Magyar announced his application to be, anyone could send their application, and I was one of 500 of Hungarians who sent their application, and now I'm here because I wanted to do something for my country and for my son's future, to give him a better Hungary. But when this whole thing started, I really didn't realize how hard it is for my wife, because I was traveling back and forth, and she was alone with our son for the whole week. And when she first talked about this, it was really hard to understand. And then I just realized when we had a very deep discussion, and he shared her feelings and this separation and loneliness, and that she felt that she lost her life and identity, and she mentioned that she has this brain fog. And I started to realize that how difficult it is for her, especially that I'm not there to help, because previously we did everything together, went together everywhere, and yes, I still feel very bad that I realized so late this, but sorry.
It is very important. We should support this, yeah, because your role is so much important right now. I think that we should engage our partners to feel the same, to have empathy towards their wives and their partners.
Thank you. And thank you. And as Gabriela said, in Hungary, is to have a babysitter is absolutely a taboo, and we consider it, and we just.
In my country, it's a taboo for men to show empathy to their wives.
And you are right, and I would like to highlight also that women today carry a especially big, heavy burden, and they are expected to excel many multiple roles at the same time, at home, at work, in society, all at once, and yet we speak about equality and expressions, expectations placed on women. One hand, what we see all over the world, we see these idolized images on social media and online, women effortlessly balancing between careers, caregiving, personal wellness, and show that it is very normal, and they are happy and no problems, and also I think it is for us, for men also. A challenge to realize that behind of these ideal pictures there are a whole team working on this, because they're going for the viral content and to reach a big audience, and hiding the truth, and making the truth and what you said, a taboo. And on the other side, we see these extremist politicians who attempt to confine women to traditional roles, sidelining their voices while claiming that they support them. But we see that it is also a lie. And too often women's mental health is impacted by invisible standards, social economic determinants, and by the constant pressure to perform, to conform, and to prove their worth. Women should not have to fit into boxes in order to be accepted. And I would like to underline this. True equality means creating space for women to be seen, supported, and safe in all their complexity. Women are often expected to balance unpaid care work with professional ambitions, navigate leadership spaces where they remain underrepresented. And I hope this discussion today will have a greater impact. Placing women's well-being at the center is not a symbolic gesture. It is a necessary shift in how we design our mental health policies, how we build communities, and how we define care. So this panel brought together the intersections of culture, women's mental health and well-being, and showed us not only the challenges but also the hope, creativity, and solidarity that can drive change. So as we close today's session, I warmly invite you to join us to our evening at our 6 p.m. at our closing reception on the ground floor, where we will present our call for an EU action plan on youth mental health. We are hear directly from young students involved in theater projects, putting their voices and experiences at the center of the conversation, and then continue our discussion with experts and advocates. So I hope to see you all there, and I thank you for being here, both person and online, and sharing your experiences and knowledge, and helping to find how can we shape better policies here in the European Parliament. Thank you very much. Thank you.
I'm sorry,